This is a quick review of health history and physical exam from the Harding Medical Surgical Textbook. This is a review of the objectives that we will be going over today. Data collection. A registered nurse with the necessary knowledge, skills, and ability may collect information pertaining to a patient's health history and perform a physical exam. When performing a history and physical exam, the nurse should make a timely report to and consult with other members of the healthcare team and make referrals as necessary. Data collection. Obtaining a patient's health history and performing a physical exam are activities completed by the nurse during the assessment phase, which is the first step of the nursing process. The information obtained during this phase contributes to a database that identifies the patient's current and past health state and provides a baseline against which future changes can be evaluated. The purpose of the nursing assessment is to enable the nurse to make a judgment about the patient's health. However, it is performed continuously throughout the nursing process to validate the diagnosis, evaluate the patient's response to the nursing interventions, and determine the extent to which patient outcomes and goals have been met. A medical history is a standard format and is designed to collect data to be used primarily by the healthcare provider to determine the risk for diseases and diagnose a medical condition. The healthcare provider's physical exam and lab and diagnostic tests assist in establishing a medical diagnosis and evaluating specific medical therapy. The information collected and reported by the healthcare provider is also used by the nurses and other healthcare teams, but within the focus of their care. An example is a patient has abnormal results of a neurological exam and it's due to a brain lesion. The nurse may use those same results to identify a nursing diagnosis of risk for falls. The physical therapist may also use the results to plan therapy involving exercise, splints, or ambulatory aids. Nursing history subjective data. The health perception health management pattern includes information about the patient's ideas about risk factors. This includes healthcare behaviors such as healthcare promotion and illness prevention activities, medical treatments, and follow-up care. Nutrition metabolic includes daily consumption of food and fluids, their favorite foods, use of dietary supplements, skin lesions and ability to heal, what is the condition of the skin, their height and weight and temperature. A general survey can describe the patient's general nutritional status. Elimination patterns. Describe the regulation, control, and removal of byproducts and waste in the body. The patterns of bowel and urinary excretion, perceived regularity or irregularity of elimination, the uses of laxatives and changes in times, modes, quality, or quantity of excretion. Activity exercise is patterns of patients' exercise, activity, leisure, and recreation. The ADLs which require energy expenditure and factors that interfere with the desired pattern, such as illness or injury. The sleep-rest pattern. This is a pattern of sleep and rest or relaxation in a 24-hour period. It also includes perceptions of quality and quantity of sleep, rest, and use of sleep aids. This is adequacy of vision, hearing, touch, taste, smell, pain perception, and management. This also includes language, judgment, memory, and decisions. Self-perception and self-concept. Feelings about self and the hospitalization are assessed in the self-perception, self-concept pattern. This can also be perceived abilities, worth, self-image, and emotions. Look at the body posture and movement, eye contact, voice, and speech patterns. Role relationship pattern. This is perceptions of major roles, their relationships and responsibilities in the current situation, satisfaction with or disturbances in their roles and relationship. Sexuality reproductive pattern. Satisfaction with sexuality or sexual relationships. What is their reproductive pattern? The female menstrual and perimenopausal history is important to get. The coping stress tolerance pattern includes information about other major stressors confronting the patient, the capacity to resist challenges to self-integrity, the methods of handling stress, support systems that are in place, their perceived ability to control and manage situations. The value belief patterns are values, goals, or belief, including spirituality, that guide choices or decisions. It is perceived conflicts in values, beliefs, or expectations that are health-related. Physical exam objective data. Inspection is the first of the major techniques used in the physical exam. Performing a physical exam of the chest uses inspection, palpation, percussion, and auscultation to determine respiratory status and differentiate primary lung problems with cardiac problems. When assessing the abdomen, auscultation is done before palpation or percussion, because palpation and percussion can cause changes in the bowel sounds, and that alters the findings. The types of assessment. A comprehensive assessment is a detailed health history and physical, and done when the patient is stabilized. A focused assessment is needed when a patient has clinical symptoms that indicate a problem. The screening exam or assessment is used to assess for possible problems such as colorectal cancer in patients who are age 50 or older. An emergency assessment is done when the nurse needs to obtain information about life-threatening problems quickly while simultaneously taking action to maintain vital functions. The nurse may need to ask only the most pertinent questions for a specific problem and obtain more information later. A complete health history will include subjective information that is not available in the healthcare provider's medical history, and family members may be able to provide some more subjective data, but only the patient will be able to give subjective information about the degree and severity of their shortness of breath. Okay, so here's a couple of NCLEX questions. The first one. When obtaining an initial health history from a patient who immigrated to the U.S. several years ago, it is most important for the nurse to ask permission to touch the patient, explain to the patient the values and beliefs of his or her own culture, determine the extent of the patient's identification with the cultural group, and engage the patient in general non-threatening conversation before asking direct questions. So looking at NCLEX, the first two to put to the side here are going to be 2 and 4. And now you're going to choose your answer between 1 and 3. So between 1 and 3, then number 3 is going to be the correct answer. Nurse has to be sensitive to potential cultural influences such as issues of eye contact, space, modesty, and touching. To avoid violating any cultural-based practices, the nurse should first ask the patient about cultural identification and/or practices. Okay, here's the next one. During the care of culturally diverse patients, the nurse knows that knowledge of cultural beliefs and behaviors may lead to stereotyping patients of one culture, the tendency to develop ethnocentricity, unconsciously imposing one's own culture on others, and confusing the values and beliefs of one culture with those of another. So the first two I put to the side here were 2 and 3. And then looking at between 1 and 2, number 1 is going to be the correct answer. General knowledge of cultural beliefs and behaviors should not be applied to all individuals from that cultural group. The nurse must assess each individual's beliefs, their customs or practices, and stereotyping should be avoided. For an FYI, ethnocentricity means the tendency to evaluate other groups according to the values and standards of one's own ethnic group.